Hello everyone. Today we discuss about the jibe taken by the WHO Director General against the world leaders who are deniers of the virus and the overall situation of the coronavirus pandemic across the globe. The WHO chief Tedros Adhanom Ghebreyesus at the WHO headquarters in Geneva, Switzerland, said on Monday, while numerous countries have now brought their previously explosive outbreaks under control, namely those in Europe and Asia, too many countries are headed in the wrong direction. The WHO warned that the pandemic is worsening globally and that there will be no return to the old normal for the foreseeable future. He cryptically criticized political leaders without naming them for their mixed messages amid the coronavirus outbreak, undermining people's trust on the experts. He further asserted, if the basics aren't followed, there is only one way this pandemic is going to go: it's going to get worse and worse and worse. As worldwide there are more than 13 million positive cases and 5,72,000 casualties, the deaths from the virus have been rising in the US, especially in the south and west, though they are still well below the numbers reached in April, according to data from Johns Hopkins University. The US President Donald Trump had once famously said, the coronavirus will simply disappear in the heat of April, and we now know that his country has the highest number of cases, standing at more than 3 million, and deaths at 138,000 as on Tuesday. Admiral Brett Giroir, a member of the White House coronavirus task force, called mask wearing in public absolutely essential but has been met with resistance in some US states. Even the President Donald Trump wore a mask in public for the first time on Saturday, and it was deemed so rare and hence obvious act that it gave hopes to many that the change in his attitude might be helpful in stopping the spread of the coronavirus. The University of Florida epidemiologist Cindy Prince said, I really do think we could control this, and it's the human element that is so critical. It should be an effort of our country. We should be pulling together when we are in a crisis, and we are definitely not doing it. In Florida, where parts of Walt Disney World reopened on Saturday, 15,299 people tested positive for a total of 2,69,811 cases and 45 deaths recorded. Further, Anthony Fauci, the top US infectious disease expert, warned that the pandemic is worsening in the US because the country lacks a coherent strategy to contain the virus. He suggested that states struggling to combat the virus should seriously look at shutting down despite the state efforts to reopen in order to revive their economies. However, Trump is not alone. There is a hall of infamy of like-minded world leaders who have deliberately denied or downplayed the dangers posed by the virus. Their carelessness is leading to a large number of cases and deaths in their respective countries. Brazilian President Jair Bolsonaro had managed the pandemic in the most disastrous manner. His dismissal of the virus as a little flu, bragging that people like him who have had an athletic past have nothing to worry about, refusal to wear a mask in public until ordered by the judiciary, promotion of unproven medicinal cures for the virus, unwillingness to impose lockdown restrictions, active encouragement of mass rallies, and firing of the health minister are all actions that defied any logic. After months of clashing with doctors, governors, and mayors over even the existence of the virus, he has now tested positive for the COVID-19 and has been in quarantine for nearly a week, and is now eager to start his regular routine since he is fed up of the isolation. Since the beginning of the crisis, the far-right president had dismissed the seriousness of the epidemic and criticized the containment measures ordered by the governors in Brazilian states, and the statistics of his country have reached 1.88 million cases and 72,833 deaths as on Tuesday. The next person on the list is the British Prime Minister Boris Johnson, who wasted the valuable early months when the virus was spreading like wildfire and shied away from preventive social distancing measures. He cheerfully insisted on shaking hands in public and then got infected himself and overlooked a health disaster that the UK has not suffered for generations. The heads of the governments of Nicaragua, Turkmenistan, and Tanzania have also more or less replicated the Bolsonaro and Johnson's models and hence plunged their societies into deep tragedy. They share the comparable traits of mistrusting the expert knowledge, stoking suspicion about formal institutions, maintaining a self image as the sole guardians of the interests of the ordinary masses. The number of infections has been rising dramatically in India and South Africa too. With a population of nearly 1.4 billion people, India stands third after US and Brazil with 9,07,000 positive COVID cases and 23,727 casualties. Biocon, an Indian pharmaceutical company, on Saturday has received regulatory approval for its drug itolizumab to be used in India for coronavirus infected patients suffering from moderate to severe respiratory distress. In South Africa, which accounts for over 40% of all the reported coronavirus cases in the continent of Africa, President Cyril Ramaphosa said on Sunday that the country would reimpose a ban on alcohol sales to reduce the volume of patients needing emergency so hospitals have more beds to treat COVID-19 patients. He said, "There is no way that we can avoid the coronavirus storm, but we can limit the damage that it can cause to our lives." In France, the government is considering requiring the use of masks in all indoor public spaces due to the small rise in virus infections and a big drop in public vigilance. Greece was seeking a ban on church and village fairs and tighter tourism related checks following a recent increase in positive cases. In Australia, Victoria's capital city of Melbourne has begun a 6-week lockdown because of a spike in coronavirus cases. The Premier of the state, Daniel Andrews, said, "Nobody is enjoying being locked at home. It's frustrating and challenging, but the strategy will be successful if we all play our part." In Japan, more than 30 mariners tested positive at the Futenma US Air Station on Okinawa, where infections among American service members have rapidly risen to more than 90 since last week. Confirmed cases have also been found at 3 other Okinawa bases. Officials said the movements of the people at Futenma and Camp Hansen have since been restricted and large-scale virus testing is being conducted. Meanwhile, 2 WHO experts are in China for a mission to trace the origin of the coronavirus pandemic. The virus was first detected in central China city of Wuhan late last year. China had been reluctant to allow a probe but relented after many countries called on the WHO to conduct a thorough investigation. As we know, whenever China comes under scanner for any international matter, the spokespersons of China speak of Chinese autonomy and sovereignty, and they directly say, "Please do not interfere in China's internal matters." Similarly, in case of coronavirus pandemic too, China had argued that the virus might have originated outside China and had angrily denied allegations that it covered up the scale of the outbreak as infections first began to spread. US President Donald Trump had harshly criticized WHO over its response to the coronavirus pandemic and accused it of bowing to Chinese influence. The Trump administration formally notified the UN last week of its withdrawal from WHO, although the pullout won't take effect until July 6, 2021. Thus, under the immense pressure built-up by many countries including India, US and Australia, China had to concede to the WHO investigation. Regarding the WHO experts in China, the country's foreign ministry spokesperson Hua Chunying said they would work with Chinese scientists and medical experts on scientific cooperation on the new coronavirus tracing issue. The WHO has confirmed the visit by an epidemiologist and an animal diseases specialist in China, but has not yet given out information on their agendas while there. The virus causing the deadly illness COVID-19 is believed to have originated in bats and then jumped to humans via an intermediary species, possibly the anteater-like pangolin that is prized in China for its scales, meat, as well used in Chinese medicine. Amidst all this crisis, we still have hopes coming from Russia, where the Seshano University has completed its human clinical trials on coronavirus vaccine successfully. That's all for today. Thank you.